Now, the UN Population Fund is decrying the slow and piecemeal approach to sexual and reproductive justice. It says while there's been some progress since 1994, there are still many challenges, and these include growing conflict, COVID-19, as well as climate change. The Social Development Department is now holding a conference to look at those issues in South Africa. So let's find out more from its Chief Director, Jacques van Zuyam, joining me, of course, this morning to take this conversation forward. And Jacques, thank you so much for your time and good morning to you. The conference, Reproductive Justice Conference, or the Sex and Reproductive Justice Conference, I understand taking place from today all the way till Thursday. Why is it important? Why is this a significant conference?
Yes, thank you very much for having us. The conference actually runs until Friday from today. With the Department of Social Development through the National Population Unit is responsible for monitoring the progress with the implementation of South Africa's population policy. And of course, one of the cornerstones of the population policy is sexual and reproductive health and rights, which works in tandem with the right to gender equity and equality and the empowerment of women, as well as various foci on youth development. So in that monitoring work, one is we are all, I think, acutely aware of the fact that a whole range of sexual and reproductive health rights are entrenched in South Africa's constitution, as well as expressed through legislation. But we've also observed that in many instances, people, and particularly women, do not necessarily enjoy those rights in their day-to-day lives. So we've worked and engaged with government departments in all three spheres of government, as well as civil society organizations, academics, and youth groups over the past 6 months to develop a better understanding of what are the factors that hinder people, and particularly women's, access to the enjoyments of those rights. And we've used the framework that has been developed by the International Population High-Level Commission, which is the Sexual and Reproductive Justice Framework, to look at those things. So we've picked up a whole lot of things, we've systemized them, and now we are hosting the conference in order to, with all stakeholders, talk through what are all the observations and what are the recommendations that can be made in order to improve the situation.
Jacques, I also found it interesting, and I want to discuss this for a moment. Part of the discussions that will take place will look at being deliberate on addressing the legacy of forced sterilization of HIV-positive women in public healthcare institutions in our country. I mean, this is such an important conversation. What have you found in terms of how far we have come 24 years on into our democracy, and this still being an issue of discussion?
Yes, it's quite shocking actually to hear that it still happens, and I think particularly for the government to hear it through the media. We don't believe that it is commonplace, but it is obviously, a legacy, practice that has somehow remained, in places in the system. It is completely illegal, and I think all health providers know that. But one has to obviously know, but why is this happening, and what more must be done in order to prevent that from happening, which includes, on the one hand, of course, educating and capacitating and training those responsible for providing services, but also on the other hand to educate South Africans, and particularly South African women, on what their rights are, what bodily autonomy and integrity means, and that you have the right to refuse certain practices, and if it does come across your way, to report it as well, so that it can be dealt with, in the full framework of human rights of the country.
Yeah, and understanding obviously that there's a special focus on women. What about men? What about young boys, young girls? Because we know that even with gender-based violence in our country, it still affects everyone. Women, men, young boys, young girls. And obviously, when it comes to children, unfortunately, there are, challenges there with their reproductive, system in some instances because of, violence such as rape, etc. Are you addressing, all demographics, all genders, all ages?
Yes, yeah. The conference does have a track that specifically focuses on men and boys and the responsibilities that men and boys have. Of course, a very large sort of set of underserved groups, which includes persons with disabilities, as well as sex workers, as well as LGBTIQ persons, also, experience greater difficulty to access services because of stereotyping and so on. So that is being attended to as well. In essence, what we have been doing over the past months and what we'll pull together in the conference is one has to look at these things across all sectors. It's not an area that one department has the sole mandate for. So for example, what happens in schools with care and support for teaching and learning, as well as comprehensive sexuality education, is as important as what happens in health facilities, as well as in the DSD offices where social work services are provided, etc. And of course, within households as well, because the experience of rights, which we refer to as sexual and reproductive justice, is something that the government plays an important role in, but also the people around you, your family members, your partner, the community in which you live, the workplace where you work, are all players that can either support your sexual and reproductive health and rights, or they can frustrate them, through measures that are not even explicitly sexual and reproductive health, but they hinder your enjoyment of your rights.
Absolutely, Jacques. And my correction there, the conference is taking place from today until Friday, 22nd to 24th of March, starting from 9 a.m. daily, the venue being Deep in the Berg Conference Centre in Pretoria, this in the Gauteng province. So thank you so much, Jacques, for speaking to us about this very important conference, shaping, policy around sex and reproductive rights, and also deepening as well as promoting the access to these rights and making sure that women, young girls, young boys, men as well, people living with disabilities, sex workers, I suppose, all of those discussions will include all that live in South Africa and how they can access these rights. So all our thanks to Jacques van Zuyam, Chief Director of Population Policy and Development, for joining us this morning.